So here you can see we've completed the removal of all of the ribs on the left side of the calf here. And then you're also completing that on the right side as well. So for the thorax dissection, we're going to look at the lung, and then we're going to remove the lung on each side and then dissect inside the chest cavity. So here on the left side, you can see the left lung, and your left lung in the calf will have a cranial lobe. So the cranial lobe is here, and the caudal lobe is here. But one difference to note in the calf is that the cranial lobe has a cranial part. So this is the cranial part, and a caudal part. So that's a difference from the pony. So in the calf, the cranial lobe on the left side has a cranial part and a caudal part. And then we have the caudal lobe here. So you're going to look at a few structures, or try to look at a few structures, by reflecting the lung and then removing it. But I'm going to, for demo purposes, remove the lung so that we can continue and just look at everything we can see from the left side. So we'll move in a little closer and take a look at that and take out the left lung. So the left lung, you'll want to kind of pull it out and see some of the structures before you take out the lung, because you're going to be cutting through the hilus. So the hilus is everything entering the lung here, but you want to make sure you're not cutting nerves and other important structures as you do that. So you remove the lung as one whole piece, and then on the calves, of course, we don't have the injection to help us distinguish things. So the bronchi, you have a principal bronchi on the left side that will then go to lobar bronchi, and the bronchi have cartilage in their walls, so those will be easier to identify. Then you'll have pulmonary arteries and pulmonary veins. So pulmonary artery should have a thicker wall. So this one looks like it's going to be a pulmonary artery right here. And then pulmonary veins should have thinner walls. So that might be a pulmonary vein here. So then we'll look at the inside of the chest cavity and start naming some of those structures. So here inside the thorax, in the calf, you'll have a lot of thymus. And so like we saw cervical thymus in the neck, you also have thymus inside the chest cavity here, and it really does get in the way, and you have to work kind of through it to find things. So don't feel bad about tearing apart some of the thymus, because you just have to get to what you need to see. So here we'll start. We'll find the vagus nerve first. So the vagus nerve is this one right here. So that's going right by the base of the heart, so right by the lungs as well, because we cut out the lungs here. So you want to find that vagus nerve, and then you can try and find the left recurrent laryngeal nerve coming off of the vagus, but it can be pretty difficult to see. And so it's going to come off, I don't know if you can see it right there, coming off, and it's wrapping around the aortic arch. Then it will go back up the trachea on the left side. So the left recurrent laryngeal nerve coming off of the vagus nerve. Then our vagus nerve will continue caudally, and then it will branch into those dorsal and ventral branches. But before we do that, I just want to point out that the phrenic nerve here is right next to that vagus nerve. So you have phrenic nerve, then you have vagus nerve right here. And then as long as we're pointing out nerves, I'll point out the sympathetic trunk. So sympathetic trunk is that one along the spine here. So sympathetic trunk up here, and then you have vagus nerve and phrenic nerve. So then we'll take a look and follow our vagus nerve caudally. So the vagus nerve, you'll see, runs underneath this vessel, which is going to get in your way as well. So in the calf, you have a left azygous vein as well as a right azygous vein in most specimens. So the left azygous vein is here, and it runs up here along the spine, right there. So that will kind of get in your way, so you'll have to work around that. But then if you trace the vagus nerve, I'm going to try and pull it out here so you can see the branches. There we go. So the vagus nerve on the left side here is branching into a dorsal branch and a ventral branch. So that will happen on the right side as well. You'll have a dorsal and ventral branch. So here you have the ventral branch on the left, and it's actually connecting right here with the ventral branch on the right. And so then from that point on, you have a ventral vagal trunk. So that will run along the ventral aspect of the esophagus here. So ventral vagal trunk, esophagus is this big guy right here. Then we have dorsal branch from the left right here. And that will come together further distally and will come together with your right dorsal branch as well. So here in the calf, you have a lot of fat to work around, just to give you fair warning. Here you have the dorsal branch from the right side, dorsal branch from the left side, and that will continue then after that point as the dorsal vagal trunk right here. So that brings us to this huge lymph node that you see here. So all of this is caudal mediastinal lymph node, or lymph nodes because there's a couple of them, but caudal mediastinal in the calf is very, very large. So we'll have that, and you can also look for the tracheobronchial lymph nodes, but sometimes they're a little hard to see. But it looks like we have one here that we had to kind of work around here for the nerve. So tracheobronchial lymph node there. So we'll continue on and look at the diaphragm for just a moment. So we have the diaphragm here, obviously, and the tendinous center is kind of the same as it was in the pony. It's that kind of see-through part here. And we have the esophageal hiatus, so you have esophagus here, and the hole through the diaphragm that the esophagus runs through is the esophageal hiatus. Here from this side you can see the caudal vena cava right here. And so the caudal vena cava, after you remove the right lung, you'll see it better because you have to move the accessory lobe on the right lung to see it. But caudal vena cava runs through the caval foramen in the diaphragm there. And here on the esophageal hiatus on either side, you have a crura, so that's that muscular part that we saw. So we'll take a look closer at that a little bit later. And then your aorta here is running down and will go through the aortic hiatus, which is way down inside. So we'll look at the heart next. You have the pericardial sac. I've removed a lot of mine, so I can't, oh, there's some there. So you'll have to cut through that and then reflect that and get the heart out of the pericardial sac to see the structures. And again, on the heart for the calf, we don't have injection, so it'll be a little more difficult to dissect. And you also have to be careful because you will tend to have a lot of fluid in the chest, so just be aware of that and be careful. So here on the heart, we are looking at the left side, but we can see the right ventricle right here as I pull it out and have the pulmonary trunk coming out of that. So pulmonary trunk is here, the left auricle you can see here, and then the left atrium and left ventricle. So here I want to show you the left coronary artery coming out. So the left coronary artery maybe is a little bit easier to see on this one, but there's a lot of fat that you have to dig through to find it. So the left coronary artery is here, coming off of the aorta, and it gives off a periconal branch and then a circumflex branch. The circumflex branch will kind of run under your left auricle in that coronary groove, and it also runs alongside the great cardiac vein, which is, again, there's no injection, so it's very difficult to see, but it's running right underneath your auricle. And so the great cardiac vein is running here. It's not full, so you can't see it very well, but just so you know where to look for it. So the great cardiac vein would be there. And then when we get to the right side, I'll point out a difference in the heart that's different for the calf. But for right now, we'll just continue here on the left side. So another thing I want to point out, so we already saw that right azygos vein. So we'll just move that out of the way. And you have your pulmonary trunk right here. You have your aorta here. So this is the aortic arch. And then we have that ligamentum arteriosum. So that connection between your pulmonary trunk and your aorta. So pulmonary trunk and aorta, ligamentum arteriosum right in between there. All right, so then we'll go back to the aorta. And so we have the aortic arch here, and we have the brachiocephalic trunk coming off of that aortic arch. So again, you have to work through this thymus tissue. So thymic tissue is kind of everywhere in the calf. But here we have brachiocephalic trunk, and that will continue cranially and give off a left subclavian artery and a right subclavian artery. So here you can see a left subclavian artery coming off of that brachiocephalic trunk. And then off of your left subclavian artery, we have some branches to name. So here, if I can maybe hold this out a little. They're a little bit harder to see. And so you have your internal thoracic will be going inside the chest here. You'll have your vertebral artery going up towards the back here. So vertebral. And you have a superficial cervical artery here. And on your vertebral, it actually looks like we have our costocervical possibly coming off there rather than as a separate branch. So vertebral, but you have this common trunk. So common trunk, and then you have a costocervical artery that would go here and would have gone to the ribs. And then we have the vertebral, which I'll try and kind of pull out here. So vertebral is going deeper up towards the back there. So vertebral, costocervical, internal thoracic, the one going down inside the chest, and then the continuation here is axillary. So that's what's going out into the forelimb, axillary artery. And we had that superficial cervical little guy right here. And then you can also see in this region where your external jugular is coming into the chest here. So you have external jugular obviously was out in the neck, and then external jugular vein comes in there and connects with the subclavian vein here. So now we'll take a look at the diaphragm a little bit closer. So here we're just taking a closer look at the diaphragm, and we have the esophagus here that's going through the esophageal hiatus. Then we have the crura, so you have a left crus here, that's the muscular part, and you'll have a right crus on the other side. And then we have the aorta here, and that goes through the aortic hiatus. So I'm just going to be able to put the probe in there, so hopefully you can see where that probe is going. It's really far in there, so hopefully you can see a little bit. But that's the aortic hiatus, where the aorta travels through the diaphragm. And now we'll go ahead and take a look at the right side of the calf.